Hello everyone, welcome back to Stud-Eye. In the last video, we have discussed about what contact lenses are and what are the purpose of contact lenses along with some contact lens parameters. In this video, we are going to discuss that what will be the pre-fitting assessment of a patient when he comes or he wanted to have a contact lens, right? So in this video, we are going to see that what are some pre-fitting assessments or what are some tests that have to be performed before the prescription or before prescribing the contact lens to the patient. So here preliminary evaluation means that what are the tests which you have to do before giving any contact lens to the patient, and that next we are going to discuss about the patient selection. Okay, so patient selection is very important. First, before going to the pre-fitting assessment, over here I want to explain about the patient selection. The importance of patient selection is that if you prescribe the contact lens to the wrong candidate, it will be harmful for the patient, because he does not, for example, if a patient is not motivated or he don't want to wear the contact lens and you prescribe the contact lens to that patient, it means that now he was not the good candidate, because he was not motivated or he didn't will to wear the contact lens. So now it will be a burden to the patient, right? Next thing is that if a patient does not have the good hygiene, what will you be doing to the contact lens? It will be a good hygiene is very important for the contact lens wearer. So if a person does not have the good hygiene, it will cause complications, because he can't take the care of the contact lens and he has not cleaned the contact lens accurately, and it can cause further complication, because any microbe on the contact lens which is born to the cornea, on the surface of the cornea, it can damage the surface of the cornea, right? So that is why patient selection is very important. Any patient that comes to you, you have to see that what he demands to you, right? So we are beginning with the case that a patient comes to you, you have done his refraction, real acuity has been assessed, you have done the subjective refraction, and number have been given to the patient, that is either the patient is myopic, hypermetropic, and etc. It's related to the refractive error. Now you have to see that do patient want to wear glasses or he wants to continue the contact lens. So he want to move to the contact lens instead of the glasses, because he is not comfortable or he has some occupational need. So this is very important, right? You just need to ask the patient's need, right? Okay, so over here you have to see the patient selection, that is there any disease. Most important thing is that you have to see that the eyes of a patient in good condition or not. If the eyes are not in the good condition, there is any kind of conjunctivitis, keratitis, corneal ulcers, or any other complication, external eye diseases, or there are some ocular diseases, in that case you should not prescribe contact lens to the patient. So in that case glasses are the good choice, right? So here you want to see that is he a good candidate or not. So first of all, you have to do the patient selection regarding to the contact lens wear. You have to do the pre-fitting assessments. Okay, so in the pre-fitting assessment you have to take the history, you have done real acuity, refraction is done, right? Now if patient says that I want to wear the contact lenses, you have to do the slit lamp examination in order to check the anterior eye segment, corneal surface, and conjunctiva, these layers, outer and tear film as well, right? So with the slit lamp you are going to assess that is eye in a condition that he can bear a foreign substance or particle or contact lens or not. Then you have to do the tear film evaluation, which includes the shimmer test or the tear breakup time, in order to see that is the tear film stable or not. So you have to see the production of tears as well as the evaporation of the tears, that is either any of the factor is disturbed or not, or either they are balanced, they are okay or not. Because this is a very important thing. If a patient is a dry eye patient, then it means that you are going to make further complication. Patient may be at risk of further complications, because I have told you in the last video on where I have discussed about the introduction to the contact lenses, that cornea is a avascular structure and it needs on nutrition from the environment as well as from the tear film. So when you will place any external substance like contact lens on the surface of the cornea dry, and the patient was of dry eye, it can cause further complication like hypoxic state may be occur over there, because of the patient was already suffering from the dry eye and you have placed a contact lens on that eye. So patient may face further complications like keratitis, corneal ulcers. Hypoxic state may cause neovascularization, so cornea can be damaged. So that is why tear film evaluation is very important, right? And slit lamp examination is also important to check the eyelids as well, right? That either there is any clasion, stye, or any entropion, any disease of the eyelid, or the anterior segments are okay or not. Are they capable of wearing the contact lens or not? Next, you have to see the horizontal visible iris diameter. So horizontal visible iris diameter is the distance between the limbus of a single eye. So from temporal limbus to nasal limbus of single eye, you are measuring it. It is a horizontal visible iris diameter. And pupil size you have to measure. Palpebral fissure height you have to see, and keratometry is done. Keratometry is done in order to see that what are the K readings, right? You know that K readings play a very important role, because you are checking the curvature of the cornea in order to see that which type of contact lens will be a good choice, which type of contact lens and base curves, and all these parameters which we will discuss about contact lens. Some important contact lens parameters which is according to every patient. So in that case you have to do these parameters, so that you can see that if you are prescribing a contact lens to patients, so what will be the optic zone area, what will be the base curve, and what will be the total diameter of the contact lens. So in that cases we have to see all these parameters. And palpebral fissure height is a distance from the upper eyelid to the lower eyelid. Palpebral fissure height is the vertical distance from upper to lower eyelid, in order to see that can the contact lens which you are prescribing to the patient stay under the eyelids or under the pressure of the eyelids, so that they may not dislocate, right? So that is why these are the pre-fitting assessments that one should do in order to prescribe the contact lens to patient. So next, after patient selection and pre-fitting assessment, you should know that what type of contact lens you have to prescribe to the patient, right? So basically we have two types of contact lenses: soft contact lenses and hard or RGP contact lenses. So RGP refers to the rigid gas permeable contact lenses, right? So those contact lenses that allow oxygen to pass through them, so that are RGP lenses, and they are hard as well. So first of all we will discuss that what are soft contact lenses. So soft contact lenses are those that are water loving, right? So the water loving contact lenses are the soft one, and they are of two types, which are soft spherical contact lens as well as a soft toric contact lens. So they are similar to those you have seen in the spectacle or the spectacle lenses, either spherical lenses or the cylindrical lenses. So you have seen in the trial box spherical lenses and the cylindrical lenses. Same, those lenses can be considered as the in the contact lens, right? So the contact lenses that have single power in all the meridian is the soft spherical contact, while the soft toric contact lenses are the one that have the power only in one meridian and are used for the astigmatism, right? So spherical contact lenses, which are soft spherical contact lenses, are used to treat the refractive errors like hypermetropia, myopia, and astigmatism, that is up to 1.25 diopters only, right? Why is it so? Because The astigmatism, which is 1.25 diopters, can be resolved with the help of tear film layer, right? So between the cornea and the contact lens there becomes a layer of the tear film, which is now acting as a optical media or the tear lens, which will give some power and correct the astigmatism, which is up to 1.25 diopters. So the myopia, hypermetropia or astigmatism, which is up to, or the low astigmatism up to 1.25 diopter, can be corrected with the help of the soft spherical contact lenses, and they range up from -20 to +20 diopters. So either a patient is of having refractive error of -10 diopters, you can prescribe the soft spherical contact lenses in that case. But the soft toric contact lenses, likewise the cylindrical lenses, they are for the astigmatism, and soft toric contact lenses are for high astigmatism, which can range from 1.25 diopter to up to 2 diopters, right, of astigmatism. So if a patient has a high astigmatism or he does not want to wear the hard lenses, which are the rigid gas permeable lenses, you can switch to the soft toric contact lens in order to correct the astigmatism, and they are really good for the regular astigmatism. So regular astigmatism is the one that are in which the both meridians are 90 degree apart, right? So with the rule astigmatism was that in nature what happens that if we see our eyes, the cornea is more steeper in the vertical meridian, because the lid's pressure is applying on the vertical surface of the cornea, but the horizontal cornea is flat because there is no lid pressure applying on them. So that is why the horizontal meridian is flat. So with the rule means that 90 degree meridian is more steeper, while 180 or horizontal meridian is flatter. But against the rule astigmatism states, and but they both are 90 degree apart. So if one meridian is 90, other will be 180. So in against the rule it is again the same, that if one meridian is 90, the other will be 180, means they are 90 degree apart. But in against the rule what happens, that it is against the rule of the nature. So what will happen over here, that the vertical meridian will be flatter while the horizontal meridian will be the steeper one, and they are less successful in the oblique astigmatism, because what happens in the soft toric contact lenses, I have told you that they are only having power in the single meridian. So in oblique astigmatism, the meridians are 90 degree apart but are not horizontal or vertical, they are in oblique manner. So they may be, if one is 45, other may be 135, right? So they are in the oblique manner. But what happens that if we are applying the contact lens, which is soft toric contact lens, in the eye, and patient was having the oblique astigmatism, what will happen, there will be some rotation of the axis, right? So we cannot place the axis in the oblique astigmatism correctly, so that is why it is less successful in the oblique astigmatism. Or you can also use soft toric contact lenses in the case where patient does not want to wear the RGP contact lenses. So next we have the RGP contact lenses, which are best for the high astigmatism from 1.25 to 4 diopters. You can prescribe patient the hard contact lenses. They are not water loving, but they allow oxygen to pass through them because they are the rigid gas permeable, so they allow oxygen, but still patient may feel a bit because they are hard, so they can cause some dry eye to the patient, and they can cure irregular astigmatism. They are good for correcting the irregular astigmatism as well as in keratoconus, because at one point the cornea becomes conical, so in order to correct that conical shape we prescribe hard lenses. Irregular cornea, if there is any irregularity in the surface of cornea, we can correct the surface of the cornea with the help of RGP contact lenses. And orthokeratology is also one method in order to correct the corneal surface, so we will discuss it in some other video about ortho-K lenses. And for post refractive surgeries we can also give RGP contact lenses, so that cornea surface may not be may not have any irregularity, or they may not change their shape. So that is why, in order to maintain the shape of the cornea, we can prescribe RGP lenses, right? So we will not go in much detail over here. So it's a brief introduction about all these contact lenses. So you have to prescribe, or you have to choose a contact lenses depending on the case. So if a patient is only myopic, then you have to give the soft spherical contact lens. If patient is having a bit astigmatism, for example, he has a refractive error of -2 diopter with -2 sphere and -1 diopter of cylinder at the axis of 180, it means that -1 diopter can be corrected with the help of soft spherical. So you don't need to switch to the soft toric contact lenses, right? So therefore you can correct the patient with these lenses as well. So therefore the contact lens selection is very important. You have to choose the contact lens according to the need of the patient. If a patient is a bit more, or having a little bit moderate astigmatism, like of about 1.75 diopters, you can switch to the soft toric contact lens in that case. But more than 2 diopter, it is good that you can use RGP contact lenses. And if there is any case of keratoconus, irregular astigmatism, in that cases you can prescribe the patient the RGP contact lenses, right? So that is why you have to see the need of the patient, and then you have to choose the contact lens. Now there is some trial contact lens parameter selection. It means we have discussed some contact lens parameters, that was total diameter, base curve and power, right? So we have not discussed about the power, we will discuss it over here now. But base curve and total diameter was discussed in the previous video, which was the introduction to contact lenses. So you can go and watch and understand the lecture over there, but I have discussed the parameters of the contact lens in that video. So out of all the contact lens parameter, 3 parameters are very important, which is base curve, total diameter and power of the contact lens, which can be also the back vertex power, right? So these parameters depend on the values of patient, or they depends on the reading the patient give us, right? So that is why they are very important. And while you are choosing the contact lenses, after the selection of contact lens, you have to select that which type of base curve I have to give to the patient, with how much diameter should be of a contact lens, and how much contact lens power will be. One more thing over here is that the soft contact lenses are a bit larger from the surface of the cornea, or they are a bit larger from the size of cornea, while the RGP lenses are smaller from the surface of the cornea, right? So the diameter of RGP lenses is less, and the diameter of the soft contact lenses is larger, right? So soft contact lenses are bigger, while RGP lenses are smaller. So we have to see, you don't have to, if a patient comes to you, you don't have to see, okay, you are going to have soft contact lens of -2 diopter, and you can go in any pharmacy and buy that. No, you have to check that the contact lens you are prescribing to the patient is fit to patient, right? Or is accurately fitting to the patient. It should not be tight or loose, right? So you have to first do the trials. You have to give patient a trial contact lens. So if I was having a patient who was having a myopia, I choose the contact lens soft spherical. Now after selection of the contact lens, I will pick a trial contact lens, and I have to see now the parameters. So I have to choose which base curve I have to give to the patient, what will be the diameter of the contact lens, and then how much power patient requires for that contact lenses. Because in the last video again I have told you that if you are giving minus lenses to the patient, minus contact lens, it should be less than the spectacle power, and if you are giving the plus lenses, it should be more than the spectacle power. So these are the 3 important parameters which should be considered. How you can calculate the base curve of a patient, you can calculate base curve with the help of K readings, right? So K readings that can either be obtained or the radius of curvature in millimeters, right? So either you can obtain it from keratometry or topography. So the radius of curvature of the cornea in millimeter can give you the base curve. Now total diameter can be calculated for any patient by measuring their horizontal visible iris diameter, which was the distance from temporal limbus to the nasal limbus of the same eye. And next we have the contact lens back vertex power, or the power of the contact lens, that can be done with the refraction. So you have done the refraction of the patient, you came to know that spectacle power will be -3. Now you have to convert that spectacle prescription into the contact lens prescription. So this thing, the third parameter, will be discussed in another video. Now we are going to discuss these two parameter. In the pre-fitting assessment, I have told you that we have to measure the, okay, let's see over here. So yeah, so in pre-fitting assessment, I have told you we have to measure horizontal visible iris diameter, pupil size, keratometry. So these three things were important in that case. So how they are important? Because by horizontal visible iris diameter we can calculate the diameter of contact lens. With the pupil size you can calculate, or you can measure that how much will be the optic zone in the millimeters. And how I have told you in the previous video of introduction to contact lens, that by adding 2 mm to the pupil size you can obtain the optic zone of a patient's contact lens. And with keratometry, with the K readings in millimeters or the radius of curvature, you can find the base curve. So how you can find this is only for the, okay, so the calculation of these three parameters will be discussed now. And this is for only the soft contact lenses, right? So for the soft contact lenses, if you want to find the base curve, what you have to do, I have told you that for base curve you need to see the K readings, and which that is radius of curvature in millimeters. So in the millimeter you have to see that K1, you get K1 in millimeter and you get K2 in millimeter. You have to see that which is flatter. So over here you need to remember that values which are less than 7.8 millimeters means that the radius of curvature is steep. So steep means more less value. 7.8 millimeter is the average or normal value of the radius of curvature, is the normal radius of curvature. But less than 7.8 millimeter shows that the radius or the cornea is steeper, means patient is turning toward myopia. And less and greater than 7.8 millimeter states that patient cornea is flatter. So the values that are greater, that are larger, they will be the more flatter one in the millimeters, right? I am talking about millimeters. In diopters, the value which is higher than 43 diopters means that is the steeper one. So if somebody has the K reading value which is 7.4 millimeter with 45 diopters, so this means that patient is myopic. And if patient has the value K readings which is 8 millimeter with 38 diopter, it means the radius of curvature of the cornea is flatter. So you have to take the flatter value, the more greater value it is, the flatter meridian it is, right? So you have to take the flattest K reading and you have to add 1 millimeter so that you can obtain the base curve. So for the understanding of the, for getting the value of base curve, you need to find the flatter K by the keratometry readings and add 1 millimeter, it will give you the base curve value. For total diameter of the contact lenses, you have to measure the horizontal visible iris diameter and just add 2 millimeter in it. Why we are adding 2 millimeter in it? Because we have said that the total diameter is the widest distance from one edge to the other edge of the contact lens, and we have said that the soft contact lenses are larger in diameter than the cornea. So that is why when horizontal visible iris diameter is actually the diameter of the cornea as well. So by adding 2 millimeter we are making a contact lens that is bigger than the cornea. And available base curves and total diameter are that how much base curves are available. Base curves are available in 8.4 millimeter to 8.9 millimeter in soft contact lenses, and for total diameters which are available is 13.8 millimeters to 14.5 millimeters. So if you get, suppose you have a total diameter of about 15 millimeter of any patient, you can see the closely related number. So you can choose the 14.5 millimeter. If you get the total diameter of a patient which is 12.5 millimeter, in that case you can choose 13.8 millimeter of the total diameter of soft contact lenses. So these are the availabilities of base curve and total diameter. Next we have the contact lens power. So I have told you that with refraction you can obtain the value which is a spectacle power prescription, right? So you can convert it into the contact lens prescription by using the formula which is back vertex power, or the power, it can also be considered as the power of the contact lens, which is equals to the spectacle prescription. FSP means that power of the spectacle. After doing the refraction you come to know the patient has the -3 sphere, so you have to put -3 over here divided by back vertex distance. So this is actually the back vertex distance compensation, because in this glasses the back vertex distance is approximately from 12 to 14, but in contact lens that is 0 millimeters, right? So you are compensating that back vertex distance with the help of spectacle power, and you are converting the spectacle prescription into the contact lens prescription. So 1 minus back vertex distance into the power of the spectacle, you can obtain the contact lens power. In next video we will discuss the contact lens power, and I will tell you how you can convert the spectacle prescriptions into the contact lens prescription. Either the prescription is for spherical, soft spherical or soft toric contact lenses, right? So now you have done, or you have calculated the parameters, all three parameters that were base curve. You have calculated total diameter of the contact lens and power of contact lens. You got a complete contact lens that has XYZ base curve, XYZ total diameter and XYZ power. A contact lens is prepared. So first step was that you have to do, or you have to see the patient selection, right? First one was to do the patient selection, then you have to do pre-fitting assessments, then you have to choose the contact lens. After choosing the contact lens you have to calculate the trial contact lens parameters, right? After knowing the parameters you have to insert the contact lens into the patient eye. After the insertion of the contact lens you have to move towards the fitting assessment of the contact lens. So we are not going to discuss the fitting assessment in this video as it's a very long topic, so we will discuss it in another video. You have to wait for it. Till then, if you get any query regarding contact lenses or the choice of contact lens or about patient selection, you can comment in comment section. Till then, thank you so much. Please don't forget to like, subscribe and share it with your fellows.